So the mental health of healthcare workers has always been important in South Africa, and especially during COVID-19. The Healthcare Workers Care Network is an initiative that started at the start of COVID-19 pandemic and really looking to be proactive and preventative work in creating more support and help to all healthcare professionals around the country. This collaboration is a group of organizations that have come together to make mental health a priority. We have the South African Medical Association, SAMA, the Psychiatry Association, SASOP, the Psychology Association, SAISA, the South African Society of Anesthesiologists, SASA, as well as SADAG, to come together to really put as much support and wellness together to support and help our healthcare professionals around the country, whether they are community healthcare workers, field workers, clinic, hospital, admin staff, especially doctors and nurses, ensuring that they too have help during this time. The aim of the initiative is to really provide as much mental health support, leadership, guidance and coaching during COVID-19 pandemic to make sure that we prioritize the mental health and emotional well-being of all healthcare workers around the country who are working in the field on a daily basis to help as many people as possible. We're trying to focus on their mental health too. During this initiative, we'll be focusing on the healthcare workers on the ground, as well as the leadership and admin personnel to provide them tips and tools as well. You can access the resources via various platforms that we've put in place to ensure that everyone can access help. You can call a 24-hour toll-free helpline, 0800 21 21 21, 7 days a week, and speak to a professional for help, resources and crisis intervention. You can also SMS our dedicated line or visit our website, healthcareworkerscarenetwork.org.za. You can also access help through different online digital platforms, including Vula Mobile and EM Guidance.
We have a problem because the world is going through an unprecedented experience, something that has not happened to all of us ever. And the healthcare workers, like everybody else, are all very anxious. They are frustrated, they are stressed, they are afraid. And it is a new thing for all of us. Our healthcare workers are highly trained, very skilled and dedicated. But unfortunately now the difference is that they have to work under extremely different circumstances. They now have to worry about themselves, about their families, about their children. There's also other economic worries that are on board, like financial status, as people are staying out of work. And there's also different working circumstances. Before, healthcare workers came in, did their work and went home. But now there's all this. First of all, they have to look after themselves in terms of what they're wearing, the masking, the hazmat suits. They have to be more careful. They have to also have worry that the patients are not infecting them and they are not infecting the patients. Everything has changed. And because now we are expecting that the numbers are going to go up, also the scheduling of healthcare work is going to be different.
So as the collaboration between the societies has grown, it's been amazing to see the absolute outpouring of support from mental health professionals all over the country. Psychologists, psychiatrists, registered counsellors, and we've got over 500 volunteers on our database who are willing to help their colleagues, fellow healthcare workers. The help that is available includes individual sessions and group sessions. Any healthcare worker can reach out via our website or via our helpline, and our volunteers have graciously offered 4 pro bono sessions to any healthcare worker in South Africa. We are also hoping to run out online group sessions, and we have many psychoeducational tools and training available to healthcare workers.
We need to remind our healthcare workers that what they're experiencing is normal and is to be expected under the circumstances. We need to remind them to take better care of themselves, to be directed at taking care of themselves, and should they need help, they should reach out quickly, because it is not a weakness on their part. We have to make them aware that what is going on and how we're dealing with this coronavirus situation is not a sprint. It is going to be a marathon. In fact, beyond that, it's a relay. We as mental health care practitioners, we want to support them, our colleagues, as they deal with their load that they have to deal with.
So healthcare workers like myself are not known for seeking help, especially for mental health needs. And that is why an initiative like this is so important. We are providing support and coaching for the emotional stresses which they may be going through. healthcare workers are used to being in control. They're used to helping others and not helping themselves. And that's where it's very important to change this narrative, especially during this pandemic.